Segment on dentistry, we're going to talk about something called vertical dimension, or a loss of distance between both of your jaws. Joining us now to help out with that is Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. Dr. Goeringer, good to see you.
Good to see you too, Dave.
So when it comes to loss of vertical dimension, kind of explain that a little bit. What are we talking about?
Well, vertical dimension, as you said, is just the distance between the two jaws. And that vertical dimension is meant to stay the same throughout life. Now, people are living longer and longer today. It's not unusual to see people in their 80s and 90s these days. So that vertical dimension changes over time, even just with normal wear and tear. And the vertical dimension should only change a millimeter or two over many, many years. But certain times, you lose more vertical dimension than you should.
So when the vertical dimension is lost, what are some of the things that can happen? I know it kind of varies by age, correct?
Well, it starts at a young age. If you're a young person, you're grinding your teeth, you'll tend to lose vertical dimension. In other words, the jaws will come closer and closer together. If you lose posterior teeth, you tend to lose vertical dimension. Those are two of the most common ways at a young age. Now, as you go into middle age, that process continues. And in middle age, along with the loss of teeth and the loss of vertical dimension from grinding, you also continue to lose posterior teeth, and that vertical dimension even becomes less and less. And then you have other problems as time goes on.
And this could lead into other issues as well. What happens once you continue to have problems with vertical dimension?
Well, what happens, you lose your posterior teeth, you tend to chew on your front teeth, and they wear down. You end up with the classic scene of someone with teeth that are wider than they are lengthwise, and you'll see people with very short teeth. The jaws will come closer together. You'll get wrinkling. It'll make you look older. And the other problem is you have the joint tends to deteriorate too, because the relationship with the joint isn't what it should be, because that jaw isn't open to the proper relationship that it should be.
So what are some solutions for those suffering with vertical dimension issues?
Vertical dimension, if you have a problem with vertical dimension, the main reason is you've lost teeth in the back. You replace those missing teeth that you have in the back. And you can do that with implants or bridges, anything like that. A partial appliance will sometimes works. But the main thing is restoring that vertical dimension, and then those problems go away.
All right, Dr. Goeringer, for our viewers that may need help in the world of dentistry and they want to contact you for an appointment, how can they do that?
Well, on the screen you'll see my phone number. It's area code 570-675-3646, or my website's drgoeringer.com.
All right, Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. Thanks so much for being on the show.
Good to see you again, Dave.
Cork Bar and